heart of Sanjoli, Shimla, something truly special is unfolding. A space where every child is seen, heard, and understood. Welcome to SATTV, a center for children with special needs, led by occupational therapist Dr. Vishveka, whose journey from Gujarat to Sanjoli is as inspiring as her mission. So my first question for you is, let's start from the beginning. What brought you to Shimla from Gujarat?
So it was just one incident and it was just one day that I met one parent and obviously they are from here, Shimla. और उन्होंने मुझे boost किया कि why don't you open your clinic here? And I was so skeptical about that. I was like, I don't know, what if I don't get any client or something, you know? But then eventually I came here. I took this place within one day.
So was there a personal experience for you which I know served as an inspiration for you that you want to work with children with special needs, like a particular experience, or it was always in your mind ever since you were young? How did
Not
it
really. I took the admission in this occupational therapy course because of my mom. Because my mom told me, and I just took the admission. And eventually, by getting the graduation and everything, I really got to know about the field, that how as an individual person I can change someone's whole life. And I loved the idea at that time. So since then I'm working in the same field. It's been 8 years that I'm working as a pediatric occupational therapist.
Wow. So 8 years in the field, 8 months in Shimla.
Yes, 8 is something.
So what were some of the biggest emotional or practical challenges you faced in setting up this place in Shimla?
Lot of, actually. Sometimes I feel like being a carbon, that I absorb people's emotions, whether it can be bad or good. You never know, right, how other people think about you. So sometimes I feel like I'm being a carbon and I'm absorbing all kind of emotion, all kind of emotions from the parent, from the kid, from my therapist, everybody. So I'm seeing myself as a nurturer now rather than seeing myself as a businesswoman or something.
So how did the local community initially respond to this place? I think you told me 15 days it took for the first.
It was so miraculous. I got positive responses, to be honest. And first of all, I really want to thank my landlord. The lady, she's a gem. She helped me a lot. And about locals, I think eventually they got to know about the place and the work I do. So I got good responses.
Amazing. So can you tell me a bit more about SATTV? First of all, why SATTV? Why did you keep the name SATTV?
I really don't have any story about it. I asked my mom, as I love my name. So I asked my mom, Mom, I'm going to start this and blah, blah, blah. And just give me a name. And my mom gave me, I never asked her why.
So tell us a bit about the children of SATTV. What kind of therapies do they receive over here?
Right. So we treat multidisciplinary approach, basically. And we treat autistic kid, ADHD, Down syndrome, GDD, delayed development, and dyslexia, all other kind of learning disabilities and physical disabilities.
So in a place like Himachal, where awareness about special needs is still, I think, pretty on a downward trend, maybe people don't know much about children with special needs. So what role do you see SATTV playing in that?
I'm seeing that a lot of people are now accepting, first of all, that that's okay having special needy kids. That's okay. So I think SATTV is providing them a place where they can grow. And I believe in, rather than hiding their identity, parents and someone should provide them a place where they can grow as they are.
Definitely.
And first of all, acceptance is really important in this matter.
I think that doesn't happen at all. I don't know, I've seen families, I know someone, I was telling you, they were dyslexic, I was pretty sure about that.
Right.
But ever since I was young, I've seen them, being treated like, nikammi hai, padna nahi chahti, ye nahi karna chahti. And then I was
because when I was young मेरे को भी इन चीज़ों की knowledge नहीं थी. It's over the years when I grew older then I started
वो
to
तो
came to know
अभी
about
भी है.
things.
एंड ओके, अगर मैं गुजरात और हिमाचल की कंपैरिजन करूँ तो अभी भी वहाँ पे ऐसा है कि 2-2.5 साल का अगर बच्चा बोलता नहीं है तो वो डॉक्टर के पास लेके जाएंगे. पर अगर हिमाचल में 2-2.5 साल का बच्चा अगर बोलता नहीं है तो वो पहले लेके जाएंगे किसी मंदिर में, किसी तांत्रिक के पास, और आई डोंट नो, सम सुपरस्टिशंस आर देयर, राइट? तो अभी भी ये चीज़ें हैं जिनको हमें फाइट करना है और मेडिकल साइंस को आगे रिप्रेजेंट करने इस चीज़ को कि वी कैन ऑल्सो हेल्प.
Definitely. So what's like a story from your life, from SATTV, from the 8 years you were working in this field before this, that touched you?
I mean, as I told you, being occupational therapy is not that easy, you know. You have to become that one person who absorb everything and who give everything. So I think there is not just there is
emotionally
not just
very heavy.
It's very heavy sometimes. So it's not just one incident, it's everyday's miracles. Just for an example, अगर यहाँ पे रोज कोई बच्चा आ रहा है, थेरापी ले रहा है और उसने वन डे, एक दिन उठ के जो बिल्कुल स्पीचलेस है, उसने माँ बोल दिया.
Wow.
तो हम सब थेरापिस्ट मिलके उस डे को सेलिब्रेट करते हैं विद पेरेंट. अब सोचो, इट्स अ स्मॉल जेस्चर, राइट? इट्स अ स्मॉल थिंग, लेकिन उनकी दुनिया में, उन पेरेंट और उस बच्चे की एक छोटी सी दुनिया में ये बहुत बड़ा अचीवमेंट है. सो दैट्स हाउ इट वर्क्स. आई मीन, छोटी छोटी चीज़ों से वी सेलिब्रेट ह्यूज थिंग्स.
So yeah, we've come to the last question already. So the last question is for people watching this who may not know where to begin with.
Right.
With coming to help, like, you know, supporting children with special needs. What's something simple but impactful they can do in their lives towards these children?
Being their parent?
Being their parents or someone else who knows someone like that. So as a person, what can you do in their lives?
Well, as a person, first of all, you need to recognize the difference between special needs and normal thing, right? Normal human behavior. अगर ऐसा आपको लगता है कि ज़रा सा भी डिले है माइलस्टोन में, डिले किस में? माइलस्टोन में. सबके एक स्पेसिफिक माइलस्टोन होते हैं, ठीक है? लेट मी सिंप्लीफाई दिस कि 1 साल का बच्चा है तो वो चलना सीखेगा. दैट वी नो, वी ऑल नो. अगर वो चलना नहीं सीख रहा है 1 साल में तो क्या ये एबनॉर्मल नहीं है? दैट इज समथिंग डिफरेंट, राइट? वैसे ही हमारा जो फर्स्ट बर्थडे सेलिब्रेट होता है उसमें कैंडल लगती है. वो क्यों लगती है? उसका भी एक पर्पस है कि वो बच्चा खुद ब्लो करता है. दैट मीन्स वो ब्लो करना सीख रहा है. उसके बक्सीनेटर मसल्स जो है वो रेडी है टू ब्लो, शक एंड अदर थिंग्स, राइट? अगर वो नहीं कर रहा है, ये सबको पता है कि तो करना चाहिए. अगर वो नहीं कर रहा है, दैट मीन्स वो एबनॉर्मल नहीं है. तो ये ask that question to yourself and your relatives as a parent. And when you know कि yes, my kid really required some special needs, so rather than going to some tantric and temples and everything, I mean, that's your belief, you can believe, but also accept that your kid requires that special attention and special need.
I think that's the first step, because a lot of people are just in denial कि ये तो ऐसा ही है. वो acceptance is like
true. तो जिस दिन वो acceptance rate बढ़ गया, उस दिन मुझे लगता है कि disability rate भी काफी कम हो जाएगा.
That's it. It was amazing talking to you.
Yeah, same.
Thank you for doing this.
Thank you so much for coming and visiting SATTV.
Yeah, thank you. And you're doing amazing work. I think it comes more into the limelight, and you know, more people come, and like, you know, and there's like a growing awareness about this thing for sure.
Yeah.
Definitely. Thank you for doing this. Thank you.
Thank you so much.